The chair will move House File 1419 to be laid over for possible inclusion in the finance bill. And Representative Hassan, I understand you have an author's amendment. Would you like to move that right now?
Yes, Madam Chair.
All right, so do you, we can just put it on the bill and then you can discuss the bill as in the form that you would like. So the chair is going to move the author's amendment, the A1, to put the bill in the proper form. And so we'll just do a voice vote on that. Are there any questions to that before we get it on the bill? Seeing none. So if you would unmute yourselves, members. All in favor of adoption of the A1, please say aye.
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 Any opposed? Okay, the motion prevails. The amendment is adopted. So now it's all yours, Representative Hassan.
Thank you, Madam Chair. And I had two bills up at the same time, so that's why.
It's all right.
Madam Chair and members, thank you for the opportunity to present House File 1419 relating to health, creating a public awareness campaign on the dangers of using skin lightening creams containing mercury. They say beauty is in the eyes of beholder, but I say beauty is in the eyes of those who set the standards for society. Our beauty standards are centered around Eurocentric view of the world. To shed a light on how troubling and far spread this skin lightening issue is, let's look at our beauty standards in the United States. We have a history of considering fair-skinned folks to be more desirable than folks with darker skin complexion. If you travel far east in China, you will find the same beauty standards that are centered around fair skin. Not to mention, India's caste system is based on Eurocentric beauty standards as well as social class. In Africa, where almost everyone is Black, we still have the same struggles around this fair skin issue. Why are we talking about fair skin issue? Well, women are using creams filled with mercury and other toxins to brighten their skin so they can have fairer skin and considered beautiful by our society. They are endangering their health and their children's health. With that, Madam Chair, I have a testifier who has been working on this issue for almost as long as I know her, Amira Adawe, who will give us a brief overview of this issue. Thank you.
All right, thank you, Representative Hassan. Ms. Adawe, welcome to the committee. Please introduce yourself and go ahead.
Thank you, Madam Chair and member of the committee. My name is Amira Adawe. I'm the executive director of the Beautywell project, which is a nonprofit that is focusing on combating colorism and skin lighting chemical exposures in communities of color. I have been working on this issue, both research and engaging communities for more than 10 years now. Many women of color are using multiple skin lighting products. They're mixing multiple chemicals, products that contain mercury, products that contain hydroquinone and steroids. And so they use twice or 3 times a day. Women are using during pregnancy and when they're breastfeeding, which we know that mercury exposure is even higher during these times. It can pass through the fetus to the child and also through the breast milk. And so we're worrying about a lot of exposure during pregnancy, but also during early childhood development. Even these women who are using these products during pre-conception care time, they're getting exposed to so much chemicals, and many of them, they don't understand the health literacy around chemical exposures and how it's impacting their health. And so we have been working with women to understand this issue, both the public health implication, but also environmental implication, because these toxic products are ending up in the environment, but also the psychological impact, because many of these women, like Representative Hassan said, they believe beauty standard that is only based on white. And so the ideology that only if you're white, you're beautiful, it's the reason that many of these women are using. So through Beautywell, we have tested more than 500 products that contained high levels of mercury, up to 150 parts per million, which is extremely toxic. And so in 2019, the legislation that you supported helped us to expand the work that we do to educate communities, but also expand our reach to greater Minnesota and conduct focus group sessions, key informant interviews in these communities and talk to them about this issue. And so it's a huge issue, that it's a huge public health issue, huge maternal child health issue that's predominantly impacting women of color in the state of Minnesota. And it's a huge global issue, but we're having this issue in our state here in Minnesota. And so I'm testifying today in support of this bill, and the work that you're doing to support this issue it's very important. I'm here to answer any question that you have. Thank you.
All right, thank you so much, Ms. Adawe. And I'll just ask a real couple quick questions. I don't think you covered this piece, but these products with mercury are illegal in this country, right? This is not something where we're talking about banning something from being sold. These are not supposed to be sold, correct?
Yeah, so these products are illegal in the state of Minnesota and FDA, but people are still finding ways to import and sell. And then people are also buying from online retailers. In 2019, we created a campaign to go after Amazon, where they removed 15 products that we tested that had contained high levels of mercury. So people are accessing both online retailers and in-store retailers here, where we don't have good regulatory system, and it's banned. Mercury is banned here in the state of Minnesota and federal level as well.
Okay, thank you very much for that. And the other thing I just wanted to maybe have you talk just really briefly, add to this is, we're not only talking about women from Africa, right? We're talking about women with all kinds of ethnic backgrounds. I had understood that the Hmong community, this was a real problem. Could you just give us a sort of, I think Representative Hassan talked about this some, but like, this is a pretty broad-based problem, right?
It's a very broad-based problem. Like you said, Madam Chair and Representative Hassan said, this is a global issue. And so countries in Africa, Asia, and Latin America do practice skin lightening. And so in Minnesota, we have communities that are from India, other parts of Asia, communities, like the Hmong communities, Latinx communities. We work with all of these communities. In greater Minnesota, we just started working with the South Sudanese communities and some of the Burmese communities, like the Karen communities. And so it's impacting many immigrant communities, but also the African American communities that are here from America. And so it's a huge issue that's impacting all communities of color.
All right, thank you so much. So I don't see any questions. Representative Hassan, would you like to have the final word before? Oh, I do see one question. Representative Demuth.
Thank you, Madam Chair, and thank you, Representative Hassan, for bringing this forward. I appreciate what the testifier also shared. As you're talking about the other communities that are facing these challenges, how are you getting the word out, and is that part of it here? That's the first question. The second part of the question is, do we have Minnesota data specifically that is showing higher levels of mercury that is showing up for whatever reason, so we can actually look back at health data that may be directly attributed to this?
Yeah, so we're reaching out
Ms. Adawe.
Yeah, thank you, Madam Chair, Representative. We're reaching out to communities in various ways. We hold community sessions. Now we move to everything to virtual through Zoom. We have been collecting, meeting with communities and doing focus group session, key informant interviews through Zoom. So we disseminate, we develop videos and materials. And so we share through ethnic media, different ethnic media like the Hmong TV, the Somali TV, and the other the Latinx communities TV. And then also we have a program called Young Women's Wellness and Leadership Initiative, where we recruit young girls from different high schools, and they go through 16 weeks of cohort-based training about what this issue is, what these chemicals are, to build their health literacy around this issue, but also uplift them and help them see representation, because a lot of times when young people don't see representation of people who look like them, that's also impacting them. So how do we build them? How do we address the root causes of this and engage communities? And so we engage communities through radio show as well and podcasts. So we engage in various different ways, making sure that they understand, the health issue, but also how do we redefine beauty and address some of these implications. And then to answer your question in terms of data, the Minnesota Department of Health did biomonitoring research a couple years ago, where they found women from the East African communities, the Hmong communities, and Latinx communities have higher mercury exposure from the skin lighting products. And so that was done through biomonitoring research. And I believe the Department of Health was continuing to do that in some of the community-based clinics to continue and find, not only did they find mercury in their urine, when they went to their homes, the homes tested positive for mercury air, So exposure is not only limited to those who are using, but also those who live with them and those who are visiting them, since mercury was available through the air that they're breathing on. So the exposure is very high, and the department was able to document through biomonitoring research.
All right. Well, thank you so much, Ms. Adawe and Representative Hassan. Representative Hassan, did you want to say something before we lay the bill over?
No, I just want to say this issue, it's about racial equity. It's also about gender equity, because many of the people that are using this product are women. And it's about saving little babies from toxins. Thank you, Madam Chair.
Yeah, thank you very much. Thank you both. So House File 1419 is laid over for possible inclusion in the finance bill. Thank you.